Good morning. I'm Bruce Stevenson,
And I'm Linda Piccinini.
and together we are Today's Dental Consulting. And what we would like to show you this morning is a little brief video on how we think a modern dental practice should operate in order to be efficient and profitable. What we're going to show you are examples in Open Dental, because we think Open Dental is by far the best dental practice management software out there.
Because we use it and we only work with dental offices that are using Open Dental or will be switching to Open Dental.
Okay, so let's get started. With all the horrible economic factors that have been impacting dentistry lately, we all need to be a little bit more aware about dentistry as a business. However, first and foremost, dentistry is a profession, and quality patient care is always our most important concern. Hopefully, as we go through these topics, you'll see that modern computerized practice management does enhance patient care, while at the same time it makes our office operations more effective and more efficient. Our purpose is to make this efficiency as easy as possible. And the easier you can make something, the more likely it is to get done. One of the things I like to do is to send a new patient welcome email. So here's our new patient. Very quick. Go to emails. I have lots of templates. I'm just going to pick one of them. It's already been made. Click insert. So I'm 2 mouse clicks into it so far. This fills in all the information, including the patient's appointment time and date and so forth. And it has a link down here so the patient can fill out the forms online. That's what we want him to do. When I'm done with 3 mouse clicks. Here's Donald's email, including the link he's going to click on in just a second to fill out the forms online. It also has the appointment date and time in here, and a little bit about the practice. It welcomes Donald to the practice. Sending new patient emails cuts down on failed appointments. So now we're going to incorporate those forms that Donald filled out by clicking on forms, and there they are. Those are the same ones he filled out on that secure website. There's his patient registration form, all the information he put in there. And all I have to do is click on import. So boom, that fast. Can you type that fast, Linda?
No.
Okay, watch over here. It's blank now. When we close this, look at all that information. Okay, so now we're going to do the medical history. Same thing. We're going to go into forms and import. Okay, there's the medical history that Donald filled out. And just like we did with the registration form, we're going to import. So with very little typing, a couple mouse clicks, we're ready to import all that information. That fast. Look over there. None of that information's entered yet, but watch what happens when I close this window. It all came over. Just exactly as the patient filled it out. So the patient came in, had the treatment done, and now we're ready to post. Then all I have to do is right mouse click and set complete. This should be a collaboration between the chairside and the doctor. Yep, that's what we did today. We can go in the chart and check to see. There it is, going to be down at the bottom. And now we're ready to do our clinical charting. So there's our procedure. We can go in and do an auto note. This is much faster and easier and more legible. You can have as many of these in there as you want. This is basically a little checklist. Again, a collaboration between the chairside and the doctor. So it's going to prompt me. That was tooth number 14. I can have more than one tooth if we worked on more than one tooth. I'm going to say, well, there was mesial caries. You can skip these if you don't want to. And again, you can customize them any way you want. We want to document the reason why we did the crown. And you can see there's a whole bunch of possible documentations in there. But look, when I say OK, what it puts up there, a whole paragraph about why I had to do a crown on this tooth. Now it's going to prompt me for the anesthetic. Again, you can put whatever ones you want in there. It's going to prompt me for the shade. It's a little checklist. The chairside said, doctor, what shade did you use? And enters it. Your charting is done. It even put the plan in there for you. Linda, what's that funny looking button up there?
That's the fill my schedule button.
Oh, because you use that for all these different things in order to fill the appointment book. Oh, so that's where your ASAP list is, your unscheduled list, and also the recall list. Open Dental has one of the best ways to manage recalls because it keeps track of not only how many different reminders you've sent, but the methods you used to send them, whether it was email or postcards or telephone calls. It's all recorded in here. It also makes it very easy for the office manager or the doctor to ensure that the staff is keeping up sending recalls to the patient because they're all listed right there.
Those were great, Bruce. What other features do you have?
Well, it's funny you should ask, Linda, because I've got some lined up to show you right now. We want to send thank you letters to patients. If the patient's nice enough to send you another patient, you certainly want to thank them. Hopefully, they're going to send you more patients in the future, but we want to make it easy. All we have to do is click here, click down here for Mickey Mouse. He sent the patient, and click here. So we're in 3 mouse clicks so far. And there's our letter, all ready to mail. That was pretty easy. The easier you can make it, the more likely it is to get done, and the more likely it is you're going to get more patients from that patient. One thing that takes an awful lot of time is tracking down eligibility and benefits for patients that are coming in. In Open Dental, you have this little magic button called the Request button, which works with Claims Connect to do real-time eligibility and benefits. You click on that button, and in about 10 seconds, you get the next screen showing not only whether the patient is eligible, but also other information such as maximums and how much the patient has used already this year. In addition, by clicking one more button, you can import that into Open Dental. Now, this doesn't work for all plans, but in California, it works for about 80% of them. In other areas of the country, it works for some of them. But if it only works for 10%, it saves you that much time. That's very powerful.
Another thing you can do is enter treatment or treatment plans very quickly in the operatory without having to know the procedure codes. All you have to do is click on the right button over there and it automatically enters the anterior, posterior correct codes for you. Very slick.
Bonnie can do her perio charting by voice. She wears a little microphone. All she has to do is call off the pocket markings. She can also call off bleeding, suppuration, furcations, just about anything. She doesn't need to have another person come in and do the charting for her. If you make it easier, it's more likely to get done. This makes perio charting much easier.
Christy's job is to make financial arrangements with the patient, and we've given her a tool that we call Payment Options 2.0. She fills in the information on the left side of the screen, and then she can print a variety of those forms on the right-hand side to give the patient. The idea is to give patients choices, all of them yours, to try and make your treatment fit into their budget.
So, Linda, we just showed people a few little tricks about how to make their office run a little bit more efficiently and a little bit more profitably using Open Dental.
So if they have Open Dental, what do they need us for?
That's a good question. Open Dental does a really good job of teaching ground school, but what we teach is flight school. So if you want your practice to really take off using Open Dental, who should they call?
Today's dental consulting.
Got it. Bye-bye.